Hello, everyone. I'm Dr. Regina McClinton, and I am the Assistant Dean for Diversity, Equity, and Inclusion in the College of Pharmacy at the University of Michigan. It is my pleasure to welcome you to this informational webinar on our new program, our high school engagement program, where we want to introduce the profession of pharmacy to high schoolers so that you know that this is a career option that is possible for you. I'm joined on today's webinar by the college's dean, Dr. Vicki Ellingrod, Dr. Amir Labib, who is the regional director for Walgreens in the Southeast Michigan region, Miss Madison Jeffrey, who is a program manager in our DEI unit, Mr. Brent Zahn, who is a pharmacy student earning his PharmD degree, who will be the facilitator for this program, and Dr. Nick Cushman, an alum of the University of Michigan College of Pharmacy, and now a lieutenant commander in the United States Health Service, who is now working with the Indian Health Service in Oregon. So let us start with a welcome from Dean Ellingrod.
Everyone, thank you so much for being here today. I am really excited that you want to learn more about pharmacy because the honest truth is pharmacy needs you. There are so many great opportunities here, and it's really time that we as a profession understand that pharmacy is not just about medications, it's about public health and it's about population health. And I think through this program, you will learn that everything that pharmacy has to offer, whether it's working in a community and serving that community and getting to know that community and helping that community have better health outcomes, or if it's working in a hospital, or if it's working for the federal government, or it's working for a pharmaceutical company. There's so many different opportunities that are available to you once you have a pharmacy degree. So again, thank you for so much for your interest in this program, and I look forward to working with you in the future.
Wonderful. Thank you so much. We really appreciate that. We understand your schedule is very busy, so thank you for taking the time to join us this morning. Well, thank you again for joining us. And I'm Regina McClinton. I'm the Assistant Dean for Diversity, Equity, and Inclusion. And we're just going to go around and let the other members of our group this morning introduce themselves. And so, Brent, we'll start with you.
Hi, my name is Brent Zahn. I am currently in my second year of pharmacy school, what's called a P2 year, and I hope to be the facilitator for this program.
Awesome. Lieutenant Commander Cushman?
Yes, hi, Nicholas Cushman. I am a pharmacist by background and an employee of the Indian Health Service, specifically the Northwest Portland Area Indian Health Board, where I do some program coordination for telehealth now, and we'll be talking about that a little bit more, but pleasure to be here.
Great, thank you so much. And Lieutenant Commander Cushman is also an alum of the College of Pharmacy here at Michigan. Madison?
Hello, everyone. I'm Madison Jeffrey. I am an assistant program manager here at the University of Michigan College of Pharmacy for a other summer program for students who are currently attending two-year colleges, such as tribal or community colleges, to learn more about pharmacy.
Great. And Amir Labib.
Yeah, hi. I'm Amir Labib. I'm a pharmacist by trade, but currently I work with Walgreens Company. I'm the area healthcare supervisor here located in Michigan. Really excited about this program. I've been in pharmacy for the last 25 years and seen the profession change slowly initially, but with COVID, there's a dramatic change, demand for our profession. Filling in the health inequities gaps and looking at pharmacists as actual providers towards healthcare. So excited to see that we can partner all together to give the experience that's necessary in high school give you an opportunity to get exposed to what the career looks like and what it looks like in community, hospital, etc. And then from there, if he chooses it as a career, it's very rewarding, self-rewarding, and also financially rewarding. So I do believe that pharmacy will dramatically change in the next 5 years, and this is a great opportunity for you all.
Wonderful. Thank you. Thank you so much. So you are a high school student and you may be saying, why are we talking about me becoming a pharmacist now? Well, becoming a pharmacist is a journey, an academic journey, a personal journey. And so we've created this program to give you information and to share opportunities with you to learn about pharmacy as a profession. By doing this early, it allows you to start doing the kind of planning and thinking that you need for this long haul. Any career is really going to be a long haul. And so you'll finish your high school education and then go on to college. Great opportunities for you here in the state of Michigan to support you through that. And then pursue a PharmD degree. PharmD is a 4-year program, and we'll talk about that a bit more later on in the webinar. You also, as an 18-year-old, have the opportunity to become a pharmacy technician. And we have programming to support you in doing that. Pharmacy technicians are a vital member of healthcare efforts and the pharmacy profession. And many of our PharmD students begin as pharmacy technicians and then decide to continue on and pursue a PharmD career. So this is why we've brought everyone together to share information with you and encourage you to pursue pharmacy as a career. I'm now going to turn it over to Lieutenant Commander Nick Cushman, who's going to share about his journey and the work that he does with the Indian Health Service.
Yeah, thank you, ma'am. Yeah, so I think it's best to take a step back and kind of start from the beginning. So I'm an enrolled member of the Sioux tribe of Chippewa Indians from northern Michigan, born and raised, first generation college student. And really kind of how I fell into pharmacy is my best friend, his grandpa was the director of education for the tribe. And one day he was just talking to us and he threw out pharmacy as a profession. It was directed to his grandson, but he chimed in and said, Nick, you might want to look into this too. So it really all started there. I looked into that. My grandmother was the central role in my life, in my upbringing. When I initially thought of pharmacy, I thought of the elderly. I thought of the stability, the job security, the financial benefits that came with it. And I thought, why not? Let's go for it. So fast forward a couple of years, I was in high school. The opportunity presented itself to intern at the local hospital as a pharmacy technician. So I did that for a number of years while I completed high school. I was fortunate enough to be accepted to the University of Michigan for college, for undergrad. And throughout those years during the summer, I continued to work as a pharmacy technician. And just more and more, it became evident that being a pharmacist, becoming a pharmacist was something that I could do. Prior, that was just unheard of for my family situation. It was kind of that ever vicious cycle, as we call it, of reservation life. And it was my opportunity to break out of that. So fast forward, I was very fortunate to be accepted to the University of Michigan, as I mentioned. I was offered Pell Grants, scholarships, thankfully, and I did take a small amount of loans to have everything paid for, tuition, housing. One thing I didn't take into account was spending money, book money, those kinds of things. So I was broke when I got to college, absolutely broke. I was very fortunate that my best friend, the same person that I alluded to, his grandfather, also went to the University of Michigan, and we lived together. We lived in the dorms together. And he was able to loan me money. to purchase my textbooks for the upcoming courses. Again, just I had no idea what I was doing. We were both navigating that together. I got a job immediately on campus, making $12 an hour, which at the time was good money. Every previous job I had before was making about $7 an hour, and my priority then shifted from school to paying my friend back and to just earning money. So that first year was really a big hurdle for me. Kind of dug myself a little bit of a hole. And fast forward, reshifted gears and got back on track when it came to reprioritizing the education, the end destination, which was always to become a pharmacist. So 4 years later, I was very fortunate again to earn my bachelor's degree, and then came time to apply for pharmacy school. Again, that's not necessarily a cheap process either. So I was limited. I applied to a couple of schools. Was a little windy, a little twisty, curvy. But the end destination, I was accepted to the University of Michigan to go to pharmacy school. And I share that, like, some of these processes just to get you thinking about it, and just to let you know that you're not alone in navigating these potential obstacles, barriers, whether they're financial or just not really knowing how to do that. So got into pharmacy school, and it was really smooth sailing from there. The time in undergrad was kind of the struggle, the first, where you remove yourself from the reservation, from your hometown, wherever you're coming from. You remove yourself from that social support that you're used to, and you're really on your own. And but pharmacy school, the University of Michigan is just an excellent model of what that should look like, and the culture that they bring to the table there. It made it easy. So 4 years later, I earned my doctorate degree, and then I was set off to work for the Indian Health Service. So, and how that came into picture was, after my first year of pharmacy school, I again, the same director of education was talking to his grandson, who was looking at going to medical school, and said that the Indian Health Service has a health profession scholarship program. And I said, well, I wonder if they have that for pharmacy. I know you're talking about physician medical school. I wonder if they have that for pharmacy. And sure enough, they did. So that first year of pharmacy school was all loan. I had looked into the armed forces, and any other kind of avenue potentially to getting some financial support to help pay for pharmacy school. First year didn't happen. I got in. I had a lot of hesitancy, just given the price tag. It was around $40,000 for tuition, for housing, just as a lump sum loan, which to me was a lot of money. I found out about the IHS Health Profession Scholarship Program, and thankfully, with the help of a dean at the university for writing a letter of recommendation, I was awarded that. So that meant my second year, my P2 year, P3, and my fourth year were all paid for. In addition, tuition-wise, in addition, I received a living stipend, which was enough to cover my housing and enough for a little bit of pocket money as well. But in return for that, they paid for 3 years. The Indian Health Service paid for 3 years. And in return, when I graduated, I then was committed to working for them for 3 years as well, which honestly made it even easier, because I didn't really have to compete in pharmacy school on getting a job. I kind of just had one there ready for the taking. I was able to select where I wanted to go. So I graduated. I wanted to get away from the snow. I wanted to leave Michigan and I went to the Southwest to Albuquerque, New Mexico, and started my first position. And it wasn't until I was driving there with my girlfriend, now spouse at the time, driving there, that my soon-to-be supervisor gave me a call and asked if I was going to apply for the United States Public Health Service. And that's the uniform that I'm wearing today. So I had no idea what that was either. No, absolutely none. But we stopped overnight in Amarillo, and I looked into it, and it was a short application period, as a window is why he called me. I said, well, that looks interesting. And so I ended up applying. It took a little bit of time. I won't get into that. But at the end of the day, I was accepted. I was commissioned as an officer. And what we do with the United States Public Health Service is we respond to domestic health events, threats on the country in terms of healthcare. And we deploy for hurricanes, floods, Ebola, COVID. You may have seen a lot of people in a similar looking uniform. And we don't carry weapons. We deploy to provide healthcare, to triage patients when those disasters unfortunately happen. So I'm in Albuquerque. I'm at my first position. I decided that I wanted to learn more clinically, so I opted to do a PGY1 residency program, which is it's another learning environment post-pharmacy school that's available as well. And that just kind of made me more competitive for the future of where the profession is going and where I wanted to go. After completion of that, I took a position. I kind of wanted to get into a position of clinical, but also administrative, which has always been a passion of mine. So I took a position of being deputy chief pharmacist at a small ambulatory care pharmacy in rural Southwest Colorado, near the Four Corners. It was an isolated hardship site, is how they refer it, just given to the rurality of it all. And I worked there for about 2.5 years. I wore many, many hats. The pandemic happened. And it was extremely rewarding, but challenging at the same time. And I would love to talk to any of you more about the Indian Health Service, because I've had the opportunity to deploy, to do temporary 2-week tours. I've been in the bush of Alaska, to Minnesota, to more rural New Mexico when I was down there. And then it's a small world in general. But so I was in Southwest Colorado for 2.5 years, and then I was very lucky in that I found the current position that I'm in, which has just opened even more doors to what the profession is capable of offering. So I mentioned earlier during introductions that I work for the Northwest Portland Area Indian Health Board. It falls under the Indian Health Service umbrella. But I'm really out of the pharmacy now. I offer clinical advice on our telehealth programming that I really help to coordinate. But other than that, it's really just serving as an advocate for Indigenous communities, Indigenous youth, Indigenous elders, adults. The whole gamut is what we focus on doing. So the bulk of my job is coordinating telehealth, which looks to bring providers from the reservations, from the local areas online like this, to learn how to manage disease states or situations, health conditions that they usually would refer you out for. So we look to bring that knowledge to the local provider teams, and we're talking anything from hepatitis C to substance use to HIV, PrEP, sexually transmitted infections, and then advanced diabetes care, asthma, blood pressure, all of those things that you might be a little more familiar with. We look to bring all of that to the primary team so that you as an individual, as a patient, or your family as a patient does not need to go somewhere else, somewhere outside of the community with the long transportations. We all know about the funding potentially could be a barrier, the travel distance, the routes, the weather, all of that impacts the continuity of care or how easily you're able to access that care and receive optimal care. So we look to bring that to you, to the local area, to improve outcomes, to improve care from providers that you know, that you trust, and that are familiar with the cultural or other unique needs of your population. On top of that, we delve into legislative advocacy efforts. I want to take the time because it was very, very crucial that the Indian Health Service, for the first time in 2024, will receive advance appropriations, meaning they will be funded for sure, guaranteed funding at X amount of dollars, which allows you to plan ahead. Whereas normally it is year to year and it is optional appropriations. So kind of if the money's there, which causes a lot of stress, and it just makes the system that much more challenging to project out and to allocate money appropriately. So we're very proud of that legislative update. And we're getting into, we have an epidemiology center that I've been, again, as a pharmacist involved with, getting into research, publication, bringing more public health data for American Indians and Alaska Natives, which again, we're a minority that lacks in that data, which on the back end hurts us even more because we use data research to inform what we're doing, best practices. So we don't necessarily have a good representation yet. And we're working on that. So all in all, my journey was interesting. I'm not going to say it's unique because I know there's many other individuals out there that grew up in a similar situation, that went through similar things or even different things. But just to share my example as a means of just saying that it is possible and that you're not alone. And I personally would be more than happy to be a resource for years ahead to any of you, because one, it is a professional, it's part of my job now. I'm very lucky with that, but personally, I'm very motivated to be able to give back to American Indian and Alaska Natives, indigenous communities, and I'm thankful for the opportunity to be here. I appreciate Dean McClinton inviting me and allowing me to contribute and to speak today. Thank you.
Wonderful. Nick, thank you so much. We are so glad to have you here today and to hear your story. And we truly appreciate the support and work that you are doing for this program and our other program for students at two-year institutions. So thank you for just being an outstanding alum. And welcome to Hannahville Schools. We are so glad you could join us again. I just want to show you a couple of slides this morning.
And I do have a student with me, Sam.
Wonderful. Hi, Sam. How are you?
Good. How about you?
Good. We're so glad you could make it. And we'll have a time for questions. So if you have some questions for Lieutenant Commander Cushman or any of us, we'll be happy to answer those. So let me just share a few slides with you real quick. So these are just some images of people working in pharmacies. This would be a community pharmacy that you're probably familiar with. This is a pharmacy technician working in a hospital. And again, pharmacy technicians are a crucial player in pharmacy work, and many of our PharmD students begin as a pharmacy technician. It is a job you can do right out of high school, and we are able to provide funding to support you in becoming a pharmacy technician. And then we have 2 pharmacists. This is more of what you would call ambulatory care. So you kind of think of like pharmacists here, right, working with the meds and whatnot. They actually are able to put hands on patients, right? So when you go to a community pharmacy like Walgreens, right, you may do your blood pressure there. They may be able to check some of your health indicators. They can do vaccines, as we've all seen as a matter of COVID. And so there's specialized training that pharmacists can do that allow them to have direct patient interactions and provide direct patient care. And so there we are. We've introduced everyone. And so why are we doing this again? The earlier you get to know about a profession, the earlier you get to choose it and start laying out your path, right? And so Lieutenant Commander Cushman talked about learning about pharmacy as an opportunity in high school before starting college. That allowed him to be thinking about, what do I need to do? What do I want to do? What am I looking for? And so that's why we're doing this program. I love this slide, because when you think about a pharmacist, if you only think of them as the person you encounter when you go into a community pharmacy, there's so much more that you're missing. So I love to point out this one. You can be an oncology pharmacist. So you specialize in the medications needed to support cancer patients while getting treatment. You can also be a pediatric pharmacist. So you're specializing in giving drug and providing medication for children. And as you probably know, most medications are not designed or dosed out for how you give that to a child. So they have to figure out all the amounts based on the weight of the child. It's a very specified, specific kind of thing. But one of the things I like to point out is you can be a pediatric oncology pharmacist. So the degree of specialization can be more general, like ambulatory care, or a bit more specific like diabetes, diabetic care, or even uber specific, as I like to think of it, something like pediatric oncology. So these are areas, not all of them. For example, veterinary pharmacy is not on the list. So if you've watched episodes of a couple of my favorite shows, The Incredible Dr. Pol or Critter Fixers, and they're always at the end going, okay, here's your medication, here's the meds for pain relief. A pharmacist has to figure out, like, how much of the pain drug do I give for a small dog versus a big dog versus a cat versus a rabbit. Many of them work in zoos, right? And that's got to be a wild ride, because you got to figure it out for an elephant, to a lion, to a parrot, right? And so you have this wide variety of kinds of patients that you can work with. So as we go through the whole program over the few weeks of the program, we'll talk about these kinds of areas, and you'll get to hear from people doing work in these areas. So what are we looking at for the program? What we are proposing is a 3-week program that would be an hour a day in May and early June. So before you graduate is what we're hoping to do. And so in our first week, introducing everyone, doing some group activities, and then talking about what do pharmacists do and careers in pharmacy. So you heard Brent say he's a P2, he's a second year pharmacy student. So the P stands for pharmacy, and the number stands for the year in school they're in. So if you're in med school, you might be an M1, medicine, first year. Our P4 students are in their 4th years. And this is when they're out doing rotations in a bunch of these areas. All right. So they'll have a government rotation, a community pharmacy rotation, an ambulatory care rotation, et cetera, et cetera. And so while they're out doing that, they're going to share with you what their experiences are like. And that next step for them is graduation and going into the workforce. Our second year, we're going to work to create a map for you. How do you get to be a pharmacist? What does that look like? How do you pay for education, right? We'll talk about some cool stuff the pharmacists get to do, like compounding, and some more guest speakers. And then how do you even get through college and pharmacy school, and why you yourself can be a pharmacist. And so it is a goal for me of this program that you will leave knowing that you can be a pharmacist. In addition, you're going to get to do shadowing. Now, shadowing is a big thing in pharmacy education. So you're going to get to go to a Walgreens near you, thankfully for this wonderful partnership that we have with Walgreens, and shadow with a real pharmacist who is willing to serve as a mentor for you. So we really appreciate that. And Amir, did you want to say anything more about that?
Sure. Getting the experience now actually helps you through the professional program in school, because you'll see what day to day, what pharmacists do, what technicians do. If you're passionate about helping others and helping people, you'll interact with patients, and you'll see all this come to life when you're in the job shadowing program and the mentoring program. For us, for me, myself personally, it's about giving back to the profession. This is why I'm, truly enjoying this partnership, because we're seeking pharmacists that would make a difference at the end of the day, which I'm sure you all will. The job shadowing program, want to call it a mentoring program. Most of our interns that have been technicians for us before have been through that job shadowing program, and they develop a relationship with that mentor who shadowed them from high school all the way to becoming a pharmacist and becoming pharmacy managers. So
awesome. Thank you so much. And so, Sam, we've already set up the agreements for you to be able to do that. And so at our other partner schools as well, KBOCC and schools in Detroit. So that's not something we're going to try to do. That's something we're going to do, right? And so we'll figure out timing and scheduling, but we will definitely be making that happen. Excellent.
So what's really
Yeah.
neat for our situation is
Yes.
my cousin, who is just 4 days older than me and like a sister, is a pharmacist at Walgreens in
Excellent.
Escanaba. And so we were just talking last night about the email and what that looks like and getting it set up. So it's kind of nice to already have that connection too. So it's going to be something that's really neat, I think, for Sam. And
Yes.
we do have one other student who's not here today, but she's also very interested in this programming and
That's
mentoring.
excellent. So I spent several years in Lafayette, Louisiana, Cajun country. And as we would say there, all y'all come. We are happy to have you. As many students as want to participate, we are thrilled to have you, and we'll make these opportunities available for you.
Great.
So that concludes our webinar for today. But I want to open the floor for any questions, Sam, that you might have. Anything you'd like to ask Lieutenant Commander Cushman or Brent, her second year?
How long in college would you have to spend for this? Like how much years?
Nick, you want to go ahead?
Yeah, so in general, it's 6 to 8 years. For undergrad, for your first 2 to 4 years of undergraduate school, of college, and then the pharmacy program itself is an additional 4. And there's some variation in that, but usually it's 6 to 8 years in total.
Okay.
Awesome. And we have programming that can allow you to kind of shorten to get to a 7-year version. We have an undergraduate major here in the College of Pharmacy. And if you decide to go to pharmacy school here at Michigan, then that 4th year becomes your first year in pharmacy school. So it saves you a little time. It also saves you some money going through as well. Don't forget that we have here the Go Blue Guarantee, which provides fees and tuition for students. So you heard Nick talk about having some spending money. That should be the only thing you have to worry about having. And so we definitely want to chart out the pathway for your success to becoming a pharmacist. Well, with that, I want to thank everyone for coming this morning and participating. Really, really appreciate your time. Very excited again for this partnership with Walgreens, and really appreciate you, Amir, for the work you and your team have done to set up the shadowing and mentoring opportunities. And we look forward to taking full advantage of those.
Yeah, no problem. We appreciate the partnership and look forward to, seeing it grow as well. So.
Excellent. All right. Well, with that, I want to thank everyone. And this webinar is now ended. Thank you. Thank you again for joining our webinar today. If you have any questions or would like to contact me, please do so at the email address below, cop.pharm4, so cop.farmforme@umich.edu. Thanks again, and I hope to hear from you soon. Bye-bye.